Good evening. Welcome to this hot topic meeting of the League of Women Voters of the Pensacola Bay Area. I am Paula Montgomery. I'm a member of the governing board. The League is a nonpartisan, nationwide grassroots organization. We do not sponsor or back or support particular candidates or parties, and that is why we are considered nonpartisan. What we do support is voting and education to make your voting effective. Tonight's program is called a hot topic because it contains information that is currently important. In fact, if you live in Escambia County, tonight's program involves a decision you will make on your ballot for the November election. Our speaker who will present the program tonight is Dr. Kimberly Krupa. Her work is anchored in her experience as a newspaper journalist, applied sociologist, researcher, and social change leader. Born and raised in New Jersey, she received her journalism degree from the College of New Jersey while working full-time as a newspaper reporter for the Times of Trenton, where she had covered 9/11 and she covered the subsequent anthrax attacks. For more than a decade, Dr. Krupa served in various positions connected to the rebuilding of South Louisiana after Hurricane Katrina and also after the Deepwater Horizon oil spill. In July of 2017, Dr. Krupa became the Executive Director of Achieve Escambia, a cradle-to-career collective impact partnership based in Pensacola, where she works to catalyze systems change in Escambia County. We are very lucky to have her. Her topic tonight is the Escambia Children's Trust. Thank you for being with us, Dr. Krupa.
Thank you so much, Paula. Thank you, Mary Louise. And thank you to the participants, the viewers and listeners for taking the time this evening to learn about this opportunity to improve our community for generations to come. I'm here to share information with you tonight about the Escambia Children's Trust, which could be our Children's Services Council for Escambia County. This is truly a once-in-a-lifetime moment for us to invest in children, youth, and families. It's our chance to decide if we're going to invest in kids in this way. It is up for vote on the November 3rd general election ballot, or earlier if you do mail-in voting or early voting. So there are a few things I want to share with you today. This opportunity to vote yes for kids will be on the very bottom of the ballot. It's on the top right of page 3, the very last thing on a long ballot. So we encourage you when you are voting to flip your ballot over, go to the end to vote yes, to put kids first. My goal is for you all to leave here today with enthusiasm for this effort, the information you need to help us achieve this for our community. Today I'll be covering several key topics about the Children's Trust, and I'm pulling up my screen to share the key highlights with you. We're going to walk through what is a Children's Services Council, what results other Children's Services Councils across Florida have achieved, and then looking inward, what specific investments could improve children's lives here in Escambia County. Finally, before we get to Q&A, we will close with a countdown. The time is ticking. People are already voting way before November 3rd. It is an election unlike any other. And we need your help to seal the deal and make this happen for our kids and families. So let's start. We're going to first get into what is a Children's Services Council. In Florida, we need 50% plus 1 vote to be successful on this ballot initiative. And a Children's Services Council is extremely special. We in Florida kicked off what is now a national children's funding movement. We really wrote the book on how to do this well for taxpayers, how to make smart and strategic investments that achieve real outcomes, generational outcomes, population outcomes for kids and families. And it is an independent district approved by voters to improve the lives of children in this particular county. Children's Services Councils are bound by county borders. So funds raised here stay here 100% to support kids and families. Children's Services Councils provide sustainable strategic funding for children's programs. This is an evidence-based funding mechanism. Not interested in annual one-off investments. This is not a grant type of situation. This is a contract that a council enters into with a provider to achieve a targeted outcome. And specifically, the outcome must target a gap or a crack in a children's service in Escambia County. So that information is collected in order to make those investments go the furthest that they possibly can. Once the funding is in place, there are stringent monitoring mechanisms in place, checks and balances. Children's Services Councils are under the full sunshine of Florida and accountable for every taxpayer penny. We have quarterly funding requirements, accountability reports, annual county commission, transparency documents, public budgets, public meetings, hearings about investment decisions, hearings about needs that will cover every corner of the county. Because Children's Services Councils are under such a spotlight to achieve accountability and make results-based investments, they end up serving in the communities that we see across Florida that have these as a hub for child advocacy. Children's Services Councils are coordinating umbrellas. They do not run programs. This is an investment in evidence-based programs and services. And so we see Children's Services Councils being a go-to resource and a coordinating umbrella across the counties where they operate. The fiscal and programmatic accountability means that Children's Services Councils actually reduce duplication of children's services. This is not a funding mechanism that's going to duplicate what's already out there. This is to scale programs that are limited in their ability to scale. This is to bring resources to the most underserved communities in our county, whether that's after school programs or early learning programs. And we'll get a little bit more into what those gaps and cracks are later on. But the point of this is to invest in where the greatest needs are. And then in doing so, to maximize local revenue, to streamline our existing funding mechanisms, to avoid duplication, and then to develop this sustainable funding source that really targets the greatest needs. So why do we need this? We are really at the bottom of so many lists in Escambia County, and it is not for lack of trying to do better. It's simply the fact that the need is greater than the resources available. And you can ask any service provider in this county, they are all behind this. They see, child abuse record high in Escambia County, ranked to number 4. The number of juveniles ages 10 to 17 who are in jail, number 3 in Florida, all-time high. Kindergarten readiness, we have been chipping away at this for 10 years. Currently, we're 53% not ready for kindergarten. And believe it or not, that is an all-time high. So we know certain strategies are working. We just don't have enough of them to serve the critical needs that we have here. One of the data points that really got this local effort kick-started is the one you see on your screen bottom right, that we are lagging behind in what we call child well-being or child wellness. And this is a roundup of 16 indicators, and it puts us at 47 out of 67 counties, and that is an all-time low. We're really seeing critical needs in the birth to 18 space in a way that we, don't have the resources to address. So we don't think that this is a moment to put your head in the sand, to give up. We actually, the grassroots folks behind the Escambia Children's Trust who have been working on this for 18 months, we believe that we can do better, we must do better, and that we actually have the ability to achieve better outcomes with this sustainable funding stream under the accountability of Sunshine. So we can We must and we're able to do better. And we don't have to look far to see how other communities have been able to achieve better outcomes with this sustainable funding stream of a Children's Services Council. So where is this already working? We're so lucky to have these 9 case studies across our state where Children's Services Councils are knocking it out of the park in delivering better outcomes for kids. Dating back to 1946, the Juvenile Welfare Board of Pinellas was the first local dedicated fund in the United States. All of these other Children's Services Councils emerged between the 80s all the way up through 2018. In Alachua County was the last county to successfully pass the Children's Services Council referendum. This year, we've got Leon County and Escambia County on the 2020 ballot, but we've got generations of evidence-based models to build off of. So we are by no means starting from scratch. And I actually think it's a good thing that we're able to look at our peers, learn from their mistakes, learn from their best practices, and kind of catapult this thing forward in a way that none of the other councils have been able to do. In particular, we look at St. Lucie County and Miami-Dade as our North Star. St. Lucie is similar population size as Escambia County, roughly 300,000 residents. And they are investing in outcomes that sort of mirror where Escambia County's greatest needs are among kids and families. Meanwhile, Miami-Dade is a different model. They have, or they had back before the Children's Services Council, the Miami Children's Trust was passed, significant issues in juvenile gangs and juvenile incarceration. Each county has the ability to cater their investments to their local needs. This is not a one-size-fits-all initiative. And that's sort of the beauty of it. It's not just a one-time study. Children's Services Councils analyze their needs about every 5 years and adjust their funding streams where the critical needs are. So you see different outcomes emerge in all the different counties because they're making investments that are specific to their data. So Miami-Dade youth development, after-school programs, and efforts to reduce gangs. St. Lucie, similar to Escambia County, they've got a lot of gaps in birth to 5 and a lot of issues with child abuse and strengthening parents and families. So I wanted to show the 2 models here side by side. St. Lucie brings in roughly $7 million in their ad valorem tax, Miami-Dade about $350 million. And so you see the scale here and how many programs they're able to invest in, how many children reach through these programs, and what are their emphasis, what are those buckets. I could write a book about the outcomes Children's Services Councils have seen. It's really unprecedented in the social human service world. Just that first data point, under St. Lucie, 63% reduction in youth substance abuse over the course of those 16 years. And that's the type of long-term sustained investment we're talking about with the Children's Services Council. And then you can see similarly the 75% reduction in juvenile arrests. This is public data. This is not program data that the councils report. You can see this in the population data under the Florida Health Trends website. And then also you can see program data because Children's Services Councils are required to report that in voluminous, sometimes taking an entire afternoon to read reports where they itemize outcomes in every single investment they make. So just, we've got lots of information on our website to back all of this up, and for those who want the specifics, we do have them. But I think that these outcomes stand for themselves. What is the cost? So what does this boil down to for our local community? So on November 3rd, I mentioned at the beginning, the 50% plus 1 voters approved the creation of the trust. An ordinance that the County Commission adopted on July 2nd would then go into effect. The average cost for homeowners is $40 per year across our 5 county commission districts. And this would be collected with the 2021-2022 tax year. We're estimating, based on last year's valuation, a $7.8 million projected investment in children, which can then be leveraged by many of the agencies operating in Escambia County through matching dollars. We see matching funds in some of our peer counties up to 70 cents for every dollar invested by a Children's Services Council is matched. You just don't see those types of returns in any investment right now in America. 70 cents for every dollar. Those types of outcomes are what has led Florida Tax Watch to label CSCs an incredibly good value to taxpayers time and again. Then we also look at the cost if we don't. You know, if we just continue trudging along status quo in Escambia County, we're going to get what we've always gotten. Kids will struggle. Our workforce will suffer. Our economy will suffer for the lack of participation of its residents. We also see the numbers. High school dropouts, 3 times more likely to end up in jail. What is the cost of jail? $33,000 to $3,000 for 1 year, and that's our local county cost. So we're really looking at this as a long-term investment to lift up Escambia County as a whole. You know, we're tired of dragging Florida down. We want to be a spotlight. We want to be a shining star in our state. And we don't have to look far. We've got Children's Services Council counties as models. And we're really lucky to have all of that evidence to draw from. When we're looking at our investments with the Children's Services Council dollar, we're looking at targeting these types of outcomes. So reversing the tide means, you know, all children receive quality early education. All children who have a special need are detected before age 2. All children who have a special need and receive detection enter into preventative services so that we're not seeing a situation where more than half of our kids are entering kindergarten not ready or receiving special education services for a diagnosis they didn't receive until they were 5 in kindergarten, which is happening in droves in our school system when you look at our special needs data. So the ripple effect through a lifetime of not receiving birth to 5 early intervention services are right here on this screen. And it cannot be more black and white, cut and dry than this. You lose out in birth to 5, the data is against you. We don't give up on you. We don't give up on any child, but you have to fight to succeed. And that fight stays with you the rest of your life. So we're looking at 3 funding buckets. We looked at that last slide about kindergarten readiness, birth to 5. Every baby is a healthy baby. How do we do that? We have a broken birth to 5 system in our county. Many counties in America do. Very few are doing this well. We have an opportunity to build a better system that speaks to each other. So you're not just hopping from one system to the next. We're working together. Information shared by your pediatrician is shared with your preschool, is shared with your kindergarten teacher, and that we're all on the same page when it comes to building resilient kids. We have a huge need in the second bucket, out-of-school development, we're calling Ready Youth. I mentioned earlier that I have 2 adolescents, a 12-year-old and a 14-year-old, and good luck finding after-school quality programs for youth. Programs that connect to the careers of tomorrow. Programs that build skills in the after-school setting. We're doing great in career pathways in our middle and high schools. Let's extend that to the after-school hours, the summer hours, the breaks, and let's build quality programming through internships, apprenticeships. Let's engage our teens who are frankly out on the street with nothing to do. And the last one is also probably the hardest one because that's reaching adults, reaching the parents of our children, reaching families and creating stronger families that break intergenerational cycles of abuse, neglect. We see these investments really changing lives. Focused counseling and case management, we see 0 child abuse cases in Children's Services Council funded programs that target families. 0 child abuse cases. It's enough to send chills up your spine to see the types of outcomes we might be able to achieve in Escambia County by making investments like these. Here's a little bit more about that in terms of the budget. So looking at that 7.8 million and breaking that down into these 3 buckets, and then also looking at what data points we would target for improvement so that all programs and services, for example, clustered under Ready Families would need to reduce child abuse and neglect, reduce alcohol and drug abuse, reduce school discipline referrals. And as just an example of how the funding is tied to an outcome. Now, if in this contract that's signed between the Escambia Children's Trust and a given program to target a specific need, if that need doesn't decrease, if that outcome isn't achieved, Children's Services Councils revoke contracts. And so this is what also makes a Children's Services Council unique is unlike most funding streams that currently exist in our county, this is not a grant, this is not a one-time investment, this is a contract. And just like any contract, if there's a breach, the contract is revoked. First, we would try to build the capacity of that given program to serve kids. We don't want anyone not serving kids because they're not able to, or no one's doing this out of malice. Often it's training. Often it's higher skill sets to serve kids with distinct needs. And so the Children's Services Council models that we've looked into provide mechanisms to build the capacity of providers to achieve better outcomes. And that's a really key piece here. We're not just expecting our local community to turn the key overnight and improve kindergarten readiness. We know it's going to take 10 years, and that's why we have a 10-year sunset on the ballot. This will be, after 10 years of trying this out, this will be back on the ballot, and voters can decide if they want to keep this going, or if we tried this and it didn't work, let's move on. We think that accountability is important here. So I wanted to shift to talking a little bit about the campaign and what league members, what the public can see now and looking forward to November 3rd. First, I wanted to share a snippet of the actual ballot. This is a snippet of my ballot right here in that gray county referendum. You can see it's in English and Spanish, and it has a portion of the word sample as a watermark. I teased out the exact ballot language here, highlighted in yellow. It is the 3rd page, top right. After our federal and local races, after our state constitutional amendments, it is the last thing on the ballot. And we know, looking at the data on voting, that people tend not to vote down ballot. So that is a major message that we're embracing here in our campaign in these days to come. And I'll leave this up just so you all can read the ballot language. So we need your help. Those of you who have picked up on my passion for this, who see the need, or who are excited about the change this can create for our future. There are many ways to get involved. You can sign up on our website, follow us, share us on social media, primarily Facebook. What we're doing this evening with the League of Women Voters, we are doing in many different venues, and we are happy to host a virtual information session. If this is a message you want to bring to your group, your civic group, your church group, your neighborhood association, we would love to pop up in a meeting for 5 minutes, 10 minutes, a whole hour. Obviously, I could talk forever about this, and just educate people about what this is. We want to build an education campaign as best as we can in this virtual environment. We don't want to wake up on November 3rd wondering, if we should have been doing more. So bring us into your existing communities or help us host a standalone event. Making a contribution. Most folks know that campaigns are expensive. Every dollar counts. This is funded purely through our local community, grassroots contributions, $10, $20, folks making a contribution because they care about kids, they see the need, and they want to improve Escambia County. And finally, voting yes for kids, making sure to fill out that last item on your ballot to put kids first. I did want to escape from my presentation and just pull up our website really quick. This is our EscambiaChildren'sTrust.org website. And if you click on Get Involved, you will go to the volunteer form where you can fill out your name, phone, email address, your county commission district, and then how you want to get involved. And there's a long list here that you can choose from. You can also donate to the cause easily right here on our website. So we're making it as easy as possible to engage the public in the Escambia Children's Trust campaign. I wanted to share a couple of media pieces. This hit mailboxes this week. We're hearing that folks have received it yesterday and today, so it is definitely out there, and we'll continue to mail this out to folks who register to vote by mail. This went out to 45,000 households this week. And we're being really intentional about putting kids first, going straight to the end of the ballot to put kids first, and what exactly this will do with these messages: prevent, protect, promote, repeated in a different, more in-depth way on the reverse side of this mailer. We also have billboards going up and in process of going up. This billboard is actually a digital billboard, and it is on Airport, right by Sam's Club. And we think this message is so important that we put it on the billboard. 53% of our kids aren't ready for kindergarten. We must do better. This is our TV spot I wanted to play. I'm going to make sure that my volume is all the way up so that everyone can hear this. And just to warn you, it is 15 seconds. It goes by fast. And it will be playing in various spots, television and other venues. But TV is expensive, and we wanted to say a lot in 15 seconds. So just wanted to warn you to pay attention. Okay.
Vote yes for kids. Escambia County's children need our support. Vote yes to prevent child abuse, protect children from drugs, gangs, and human trafficking, and put all our kids on a path to success. Put kids first by voting yes on your ballot's last item. Paid political ad paid for by Escambia Children's Trust.
Fast, right? Wonderful. Yard and intersection signs, these are in process. You will start to see these all across our county, likely within the next week. And I wanted to say those who are interested in helping out with these signs, also, you know, when the time comes, standing on intersections and waving signs, wearing t-shirts that will have a similar look as this that you're seeing on your screen, you would want to go to our website and click on that Get Involved, and that will connect you to all of these volunteer opportunities. That is it in the overview of the Escambia Children's Trust and the supports it would bring in the school readiness, child protection, and youth development investment buckets, which are our critical needs in Escambia County. I'm happy to answer any questions that might have come up and hopefully have some dialogue.
I don't see any questions from the audience, and of course, unfortunately, we weren't able to broadcast on Facebook. So audience participants, if you've got any questions, if you would tap the Q&A button and type in your question very quickly. So on the yard signs, Dr. Krupa, I could arrange to get a yard sign to put in my front yard?
Yes, we are looking into that.
Yeah.
Okay.
All right.
And a central distribution point where folks could pick them up.
Okay. All right. So if I get that information, I can share that on our Facebook page so other members would know.
Yes.
Okay. And so what do you think the biggest obstacle is that you have to overcome to get this referendum passed?
That's a great question. When we look at the case studies of the other counties, we see campaigns that were many years in the works. And so I think we don't have the best name recognition, Escambia Children's Trust. We're sort of counting on children in the language in the ballot, the specific investment language, to bring home and bring to life what the Escambia Children's Trust, the Children's Services Council is. But I think name recognition has been a hard mountain for us to climb. You know, getting out there, getting the word out in a COVID-19 situation, you know, normally we would be blowing up the town hall and we would be popping up in every corner of Escambia County. We would be out there every night, every day, every lunch and learn, but we haven't been able to do that. And so I think that that we've just tried to plug along in this virtual format like everybody else has.
Okay. And there is one question from the audience. What is the local governance structure?
Yes, it is a 10-member oversight board. So 10 members, 5 are positional seats, and 5 are appointed by the governor based on recommendations from the county commission. So the 5 sitting members are a school board member, and usually they rotate school board members for 2-year cycles. A county commissioner, likewise with a rotation on the Children's Services Council board, a superintendent, the regional administrator for the Department of Children and Families, so that would be our Circuit 1 administrator, because child welfare is central to Children's Services Councils. And the last is a sitting juvenile court judge. And those are also usually rotated for terms because there are many juvenile court judges. But that's how important those issues are, that those members have sitting seats at the table. And the purpose of having the other 5 appointed is to more represent the county and the diversity of each county, which might not be achieved in those 5 sitting seats. So usually you see folks who are maybe experts in early child development, folks who are faith leaders who represent other sectors like the military that might not be a subject matter expert like those 5, but they bring another set of expertise that's of value to this investment process.
Okay, thank you. Audience members, any other questions? It doesn't appear that there are. Dr. Montgomery?
Yes, this has really been inspiring.
I think so too.
I count it as an opportunity. This is what we need to get behind and really get this done.
Absolutely.
I would love to have a yard sign.
Okay.
Me too. Me too. And I think it's kind of a shame that you're the last item on the ballot, but then again, it's such an easy way to remind people where you are on the ballot instead of someplace lost in the middle. So, yeah. But I'm sorry, Dr. Montgomery, I kind of cut you off.
No, that's fine. I want to thank Dr. Krupa 1,000 times for coming and telling us about this.
Right, and we'll get a good video going, and we'll get that up on our Facebook site for you too, so that members can watch it at their convenience.
Wonderful. I so appreciate the opportunity. You know, I've spoken to the League a couple times in the past, and it's always been about sort of admiring the issues that we face in our community. And frankly, some of the issues are horrific and outrageous. This is finally a chance to focus on solutions. And so I'm so glad that that message came through, and I really appreciate the opportunity tonight.
Okay. Thank you so much.
Thank you.
Okay, we'll go ahead and then end the meeting now so that the video can finish recording itself, and we'll let you know when it's available, Dr. Krupa.
Wonderful.
Okay. Good night, everybody.
Goodbye.